Today we will discuss the most important part of steroids. There are a lot of queries from my residents about the steroids. Which steroid should be used and when it should be used in Pediatric Intensive Care Unit. So there are different injectable steroids available in our Pediatric Intensive Care Unit, and you have to know which steroid is suitable in which conditions. So basic physiology is very important to know about different steroids. So I will take examples of three main steroids being used in our Pediatric Intensive Care Unit, that is PICU. These steroids are first hydrocortisone injectable, then methylprednisolone injectable, then dexamethasone injectable. So these steroids are secreted from the cortex of medulla, which is situated over the kidney, if you remember the anatomy. All steroids have properties of glucocorticoids and mineralocorticoids. The fourth one, which I have not mentioned, is fludrocortisone. So we will compare first these steroids, starting from hydrocortisone. Hydrocortisone is short-acting steroids. The duration of action is 1 hour to 12 hours. It has got mineralocorticoid and glucocorticoid properties equally, like 50-50. What is mineralocorticoid property? What is glucocorticoid property? Glucocorticoid property is anti-inflammatory property, which reduces inflammations. Mineralocorticoid property is to retain salts in the body along with water, that is, it retains sodium and water in the body while it excretes potassium. So it is mineralocorticoid activity. Now come to methylprednisolone. So it is medium acting. Hydrocortisone is short acting, methylprednisolone is medium acting. Medium acting duration of action is 12 hours to 36 hours. It has 5 times more potent glucocorticoid activity in comparison to hydrocortisone. So this is the difference. Number 3 is dexamethasone. Dexamethasone duration of action is 36 hours to 55 hours. So it is long acting steroid. It has 25 times more glucocorticoid properties than hydrocortisone and less or negligible mineralocorticoid properties. So this is mainly used where we need to reduce edema as an emergency, like laryngeal edema. In children, if there is acute laryngotracheal bronchitis, then we use this dexamethasone. In cases of cerebral edema, we use this dexamethasone. Other is fludrocortisone. Fludrocortisone has 150 times more mineralocorticoid properties than hydrocortisone. So we are comparing these steroids with hydrocortisone. So it is used mainly when there is adrenocortical deficiency, adrenocortical failure, like in shock situations where we want to retain salts and water. So fludrocortisone is used mainly for that purpose. Hydrocortisone is useful when you want to use it for a short period of time, like anti-inflammatory, like when you treat asthma, you should use hydrocortisone. Methylprednisolone is a little better than hydrocortisone because its duration of action is more as compared to hydrocortisone, and it has more steroid glucocorticoid property like anti-inflammatory property, so it is better in controlling inflammations in comparison to hydrocortisone. But duration of action is more, that is, it is medium acting steroid. So we should use these long acting or medium acting cautiously because it suppresses inflammation for a long period of time, so that it can cause suppression of immunity of the body also. So in short, I have discussed about the different properties of different steroids used in our PICU. Thank you very much. Pranam. Myself, Dr. Deo Kumar Jha, pediatrician and pediatric pulmonologist.